with Lumiere Medical. I'd like to thank you for joining us this evening for our webinar on the new exciting third generation RF technology being referenced as TriPollar. We have Dr. Stephen Shapiro with us this evening, who is going to be doing the presentation. Dr. Shapiro is a dermatologist located down in Palm Gardens, Florida. Was one of the principal investigators for the FDA study for the approval of the Apollo device, as it's called. So I feel very fortunate to have Dr. Shapiro with us this evening, because he really has a wealth of knowledge. Has treated over, I believe, over 150 cases at this point. So should really be able to address not only the applications for wrinkle reduction, skin tightening, but also some of the off-label uses we have with body contouring, cellulite reduction, etc. A little bit of housekeeping before we get started. You will have an opportunity to ask questions. What we'd ask you to do is you would please type those questions into the chat box. At the end of Dr. Shapiro's presentation, we will pose those questions to the group so that everyone gets to hear those and answer them accordingly. Also, at the end of the presentation, we will post to the group within that same chat box contact information for myself and our group at Lumiere Medical, so that if you would like a follow-up, we can do so, follow up with you, schedule a demonstration in your office, etc. So with that, I'd like to hand things off to Dr. Shapiro.
Thank you very much. Tonight we'll speak about the evaluation of safety and efficacy of TriPollar technology for wrinkle reduction. As Travis mentioned, I'm Dr. Shapiro from Gardens Dermatology in Palm Beach Gardens, Florida. And where is Palm Beach Gardens, Florida? We're about an hour and a half north of Miami and about half an hour south of Stuart in southeast Florida. This picture is a picture of our office on a good day, which is nice, without any hurricanes or storms. I'd like to acknowledge Polygon, who makes the TriPollar device, for funding the FDA study to carefully review this third generation radio frequency device. I'm a board-certified dermatologist by the American Board of Dermatology. I personally specialize in lasers, cosmetic dermatology, general dermatology, and Mohs skin cancer surgery. My special interest is in repair of the skin, and that includes multiple FDA studies. I'm a voluntary associate professor at University of Miami. I'm also chairman of the board of my malpractice company, Healthcare Underwriters Group of Florida, and I started Gardens Dermatology back in 1995. This is a picture of the TriPollar radio frequency device in our office. If you take a look on the right, you'll see the Apollo device, which is another name for TriPollar. It's very, very simple, has an easy press button system to work, and you'll see three handpieces. This is a larger handpiece that can be used to treat large areas like the abdomen, or if you want to heat up smaller areas like the neck a little bit faster. And then there's a medium-sized handpiece and a small handpiece, so you can get to the eyelids, the forehead, the temples, and areas that are a little bit harder to reach, or you need a smaller device. As we'll talk more about the device, we'll talk about the number of poles in TriPollar, which of course would be 3. The large handpiece actually has 6, though. The TriPollar specifications in our office, we just use a standard electrical outlet. It does not require 220 volts like some of the other lasers. The mode of operation is radio frequency, and the output frequency is 1 megahertz. It weighs about 40 pounds, so it's not very heavy. Ours is on wheels, so we can move it from room to room, and it's not very large in size. The FDA study that we did, we were originally given the device, and we wanted to investigate how it worked for non-invasive wrinkle reduction, especially without any downtime. It is a third generation radio frequency technology. And the analogy that I use for first, second, and third generation would be a device like Thermage, which has a single pole. And if you took a lake and you dropped a stone into that lake, you would drop a single stone and get one circle with the energy dispersed in 360 degrees all the way around that stone or pebble. Second generation would be a device like a Firm, which has 2 poles. And when you have those 2 poles and you drop 2 stones into the lake, some of the energy is captured between the 2 poles. Some of it is lost around it. With third generation, or the TriPollar, it'd be just like dropping 3 stones into the lake, and you'd have the energy more concentrated between the 3 stones and less lost to the water that's around those 3 stones. So what happens with third generation technology, you can actually use a lower energy, which makes it better tolerated, much safer too, And we were trying to find out in the study if we could still get good results with a lower energy. Radiofrequency devices generate heat through resistance in the dermal and subcutaneous fat layers. And as we talk about off-label uses for it, we'll mention cellulite down the road. The FDA study that we did was to evaluate the safety and efficacy of TriPollar system for wrinkle and ridity reduction. And in our FDA study, we had 34 subjects, 2 sites. Tonight's data is just talking about our site. So at our site, what were our safety and efficacy endpoints? Well, we were trying to find out how it worked in terms of its safety for wrinkle and ridity reduction established by physicians' assessment and observation of adverse events. We took pre- and post-treatment photographs, which were compared and assessed by 2 independent physician evaluators for wrinkle reduction efficacy. The results through patient surveys, physician observation, and independent evaluator physician scoring of those pre- and post photos. And the subject success if at least one Fitzpatrick score improvement was noticed by the independent evaluator. And the success of the study was to be greater than 60% of the subjects getting at least a 1 Fitzpatrick score improvement. We did much better than that. The study duration schedule, well, our study site was from March to August of 2011. There was a screening visit to determine the subject eligibility, their medical history, and to have them sign their informed consent. The study itself consisted of 8 weekly treatment visits, and then they had 2 follow-up visits at 1 month and 3 months after the last treatment. So the final results were really 3 months after these 8 weekly treatments. 14 of the 17 patients that we studied completed 112 treatments. There were actually 134 overall treatments performed. 3 of the 17 patients left the study for unrelated reasons, typically related to work or moving out of state. The ethical committee was the Essex IRB, and this study was registered in the NIH database. So what is the Fitzpatrick wrinkle scale? If you take a look at the left side of this slide, you'll see class 1, class 2, and class 3. Class 1 is really for fine wrinkles, and the score is between 1 and 3 for just a mild degree of sun damage. Class 2, of course, is more involved, where they have fine to moderate depth of the wrinkles and a moderate number of lines, and this has a score of 4 to 6 in this category. Class 3 represents scores of 7 to 9, where they have fine to deep wrinkles, numerous lines, with or without redundant skin folds. And this, of course, is much more severe sun damage. The observing physician scoring, and I think the important part of the observing physician scoring, which in this case happens to be mine, if you look at somebody and you grow collagen on their skin, it's been shown that you have to grow 28% collagen to make it visible to the naked eye. And that's an important point, which means when we see something with our eye, it becomes more significant. The other interesting thing that we noticed in this study is that the photographs didn't tend to show the same change that both the patient saw and the observing physician saw. So as we go through the data from the independent evaluators done by photographs, their score may not be as high, but on the other hand, what they saw was significant because they saw improvement as well. So at baseline scores on that Fitzpatrick score scale of 1 to 9, the baseline was 4.93 for the observing physician, and at 3-month follow-up, the average score was 2.5. So this is almost a 2.5% reduction in their Fitzpatrick score, and this was clinically significant. The reviewer's wrinkle score, again, was almost 4.5, the bar on the left, and then in follow-up is about 2.5, and that's at 3 months after their last treatment. So it really takes 3 months to grow collagen, so 3 months after their last treatment is when you would see the maximum benefit. The independent reviewer scoring for the first reviewer right here on the left showed a baseline of 4.36 looking at the photos, and the 3-month follow-up was 3.07. The grade reduction was 1.29, which is a significant reduction. The second reviewer had an average score of 4.57 on the photographs and a 3-month follow-up of 3.36, and their grade reduction was 1.21. So you can see that the first reviewer was 1.29, second reviewer was 1.21. They had an average of 1.25, which is very, very close and statistically significant in both cases. If you take a look at this bar graph, it shows reviewer 1, where they started between 4 and 5 and ended up just about 3. The second reviewer, again, between 4 and 5, and ended up pretty close to 3 as well. So this shows a consistency as you come across the bar graph in both independent evaluators looking at photographs to determine both baseline and follow-up final scoring. So the results of the study showed that there were no unexpected adverse side effects in this study at all. The worst thing that we saw was redness for a few hours after the treatment in one patient. Most patients experienced redness that lasted an hour or less. And with radiofrequency devices, that's an expected side effect. All the patients reported no pain or mild pain, and there is a patient turn-off switch on the device. It was never used for any of the FDA study patients, and in our clinical practice with over 150 patients treated, we have never had to use that either. What's important here is that if it gets too hot, the patient can hit this switch, it turns off the device and stops the treatment. It's very, very important that this was never used in the study or in our clinical experience. 2 blinded physicians analyzed the pre and post photos, and if there was an improvement of at least 1 on the Fitzpatrick score, then the study was just a success. We were going for greater than 60%, but in our office we were able to get 14 out of 14, where we saw at least 1 change in the Fitzpatrick score. The observing physician had a 2.4 score reduction, which means clinically, again, you would expect to see more than you see in a camera or photograph, and the observing physician saw a 2.4 score reduction. All the patients were satisfied with their treatment results, and that's very, very important. That's also been in our clinical experience and our practice as well. So here's some before and follow-up photos. If you take a look on the left, you'll see this patient. She's before her first treatment. The middle is after her 8th treatment, immediately after her 8th treatment. And then the photo all the way to the right is 3 months after her final treatment. So if you take a look, we'll start at the jawline and come up to the corner of the mouth. You can see the right corner of the mouth. As we come across, there's slight softening after the 8th treatment, and by the time you give that collagen to grow, this wrinkle goes, let's say 40% down to the jawline, and up and through here, it's really, really retracted just towards the corner of the mouth, so much smaller. If you take a look at her smile line up and through here, you can see some depth as you get to the corner of the nose, and same thing over here, there's some depth as you come up. As you start to look here, there's a little bit of softening, and then in her follow-up, her right side is only left with a little bit towards the corner of the nose, and her left side is much softer as well. We saw a similar improvement in her frown lines or glabellar lines. She's got some depth in through here, some depth is still there, and it's softened by the time we hit her follow-up. This photo doesn't show it, but we'll see in other photos better. If you look at her orbital rim, you'll see her crow's feet in through here. You'll see multiple lines in her before photo. As you come across, they're clearly softer, and by the time you get to her last photo, they're practically gone. So we saw a significant reduction. Forehead lines, which are much more difficult, I think, because they're deeper, they have more of what I call a V crease in them. Sometimes you don't see as much improvement in that area, but as you take a look in through here, you'll see her forehead, her upper line is softer, and then by the time you get to her follow-up, she's significantly improved in her forehead lines as well. If you took a look at her eyelids, they're probably elevated just a drop in through here. You know, we're not typically using that as an endpoint, but if you had measured her both before, you can see her eyelid touches almost her eyelashes, and as you get to her after, she's elevated above. So there is improvement in that area. We did not treat the neck in this patient, so you can see in her photos, she's pretty much stayed the same on her neck all the way through. Here's another patient where we treated, all these patients, they were treated on the face. Again, these are the FDA study patients. If you take a look at the corner of her nose in the photo all the way to the left, which is before her first treatment, you can track a line from the corner of her nose all the way down to the jawline. We treated to the jawline. We did not treat the neck in the study. And she's got 1 line in through here. She's got a couple lines right behind it. And as you go to after her 8th treatment and through here, you see a softening of that smile line, a little bit of a breakup in this area, and through here it's not quite as deep as it was before. And then you'll see down here to the jawline, again, a softening of the area. These were those 2 lines that were behind. Again, it looks like somebody here just took their finger, put it on the skin, and stretched the skin. And then when you go to her follow-up, you can really see significant improvement in this area where she has that breakup of that wrinkle that went all the way from her corner of the nose to the jawline, a softening of the lines in through here. She even has acne scarring, old acne scarring in the area, and you can see that it's been reduced as well. If you look at her jawline in through here, again, she's got some depth down in through here. In the middle photo after the 8th treatment, softening of it. As you get to her last photo, you can see it's almost, again, like somebody took their finger and just stretched that skin. And we'll talk more about it, but to see improvement in acne scarring, like we see in through here, is significant as well. This patient, again, the face was treated. If you look at the corner of her nose in the photo on the left, this is before her first treatment, and the after is 3 months after her last treatment. So this is clearly before and after. You have no trouble telling which one is improved. Her smile line, her nasolabial fold from the right corner of the nose comes all the way down, and you can see it down going to the corner of the mouth. You can see the jawline in through here. You can see multiple lines, crow's feet on the orbital rim, and you'll see some depth to her frown lines up in through here. And as you look in her after photo, again, it looks like somebody put their finger, stretched the skin. There's clearly a breakup of the line in through here. The corner of the mouth is not as deep as before, and her smile line is not as deep as before. And again, when you can see it in a photograph, I think it's even more significant. What we saw clinically was a little bit more. And then you can see her lines in through here, they're softened, again, like somebody put their finger and stretched that skin. And then as you look at her frown line, it's not quite as deep as where she was before. Her lines, as you come across the forehead area, again, they're softer up and through there as well. So there's significant improvement in that area. We did not treat the neck, so if you could take a look at the neck lines and see that, that the neck lines are still there in both her before and after photo. So off-label uses. Off-label uses include acne scarring, which I showed you the photo. And if a patient came to me today and said, I need something non-ablative for acne scarring without any risk, this is what I would use. If the person came in on Wednesday and said, I have to look good for a wedding on Saturday, I'd probably use a filler. But if the person's patient and they want to grow their own collagen, this is one of the best ways to do it. Cellulite reduction, if you take that large handpiece and you, with 6 poles, and you use it over like the abdomen, we actually had a problem with our staff. They ended up using it on each other and tying up the machine too much. So what we had to do was limit their use, but we noticed that it really reduced the cellulite because it penetrates into the fatty tissue to break it down. The circumferential reduction, also known as body contouring, our staff calls it the pooch. And what that is, that's the lower part of the abdomen where the abdomen just sags a little bit, and this works well for tightening that area. Our staff has used it to tighten their thighs, the buttocks, the neck, the arms, but right now the abdomen seems to be their favorite area to treat. We do have patients clinically coming in for neck tightening, and again, if somebody's a candidate for neck lift where they have extra skin and they need to have it removed, that's different. But that person who notices a problem with their neck, they're not ready for surgery, or clinically you don't think they're ready for surgery, this is a really nice device, and we're seeing quicker improvements for neck tightening than we are for the face. So they'll see improvement after the first treatment, which is significant. And that actually brings up one point. When we first were trying out this device, we were trying to figure out what it would do, how much it would do. So we took our most wrinkled staff member, who was much older, and we treated just one side of her face. And what was really interesting is she went around and showed all the other employees in the office the difference between the two sides of her face. And that really got our staff fired up to do this procedure. So that was the best internal marketing we did, was treating one side of the face. So in conclusion, the TriPollar system is indicated, FDA approved, and available for wrinkle and ridity reduction. It's non-invasive, it's safe, there are no side effects. I think the only side effect is if your technician were to hold the device still in one place too long, they would heat it up. The worst thing that would happen is the person would probably get a blister. So I tell the techs no cell phone use during the treatments. That really keeps them focused on the procedure. They keep the handpiece moving. It works really, really well that way. It's extremely effective, and it's virtually painless. Nobody's had to turn off that switch. Most patients will describe it as like a very, very warm massage, and I think that's a great way to describe it. If they become uncomfortable, they can press that button, but that's never happened in our office. And I put my email address here, drshapiro@gardensdermatology.com. Sometimes people want to ask questions, but in a group setting, they're not as comfortable, or if you think of something in a few days, don't hesitate to email me directly. Thank you very much.
Great, thank you, Dr. Shapiro. Just a lot of information we covered there in a short amount of time, and just wanted to ask again, if there's questions that you have out there, go ahead, feel free to type them in the chat window now, and we will go through those, answer them in the order that they were received. I know that we did have one question that was submitted before the webinar began, Dr. Shapiro, which really was centered around combination therapies. You know, how does this work with in combination with whether it be cool sculpting, whether it be we had a question about low-level laser devices, whether it be iLipo, Zerona, etc. If you wouldn't mind just commenting on either what your experience of it has been, opinion is on how TriPollar with its skin tightening mechanisms works in combination with those, which granted are typically on those off-label body treatments.
Right. When you combine therapies, I've always found through the years, you ask one company and it's almost like computers. You know, they'll blame the software problem on the other one and vice versa. So I think the best thing is to look at the technology itself, the target, and what you're trying to achieve. For example, if I were going to do Botox and TriPollar, or something where I was injecting in TriPollar, I would typically wait a week. If I was going to do something that changed the temperature of the skin, we're using heat to grow collagen, I would typically wait a week. So if I were going to do this cool sculpt, you know, device, or I think Zeltique is one that uses cooling, I wouldn't want to combine heat and cooling in the same area at the same time. I would typically wait a week between those therapies. I have used this in combination with low-level laser, and I am actually about to do a little study on that. And what I find interesting about that with low-level laser, you typically have to follow up with massage. And I think if you're using massage and you're heating the skin and growing collagen at the same time, you may get an additive benefit of tightening the skin and hitting your deeper target at the same time. But in general, when I use this with other technologies, laser hair removal, anything else, I keep them a week apart. But you're going to see more combination of therapies in the future, but it has to make sense clinically in what you're trying to do for the patient. So I think there are times that you can combine them, but you're safer right now keeping them a week apart if possible.
Great, thank you.
Thank you.
Okay, great. Well, I would tell you, you know, again, I appreciate everyone's appreciate everyone's time there. If you would like us to follow up with you, we can do so. It's very easy to reach us. You can send us an email at sales, it's SALES, at LumiereMed, LUMIEREMED.com, LumiereMed.com. You can also call us at area code 877-701-2699. That's 877-701-2699. I'd encourage you, if your interest is piqued by TriPollar, you really want to see what it can do. You know, reading about it. I mean, there's a wealth of information on our website. From, you know, there's 8 peer-reviewed published clinical studies. Dr. Shapiro's study that he just touched briefly on here, some of the data points, has actually been accepted for publication in Lasers in Surgery and Medicine. Will be published later this year. There are an additional 8 peer-reviewed published articles. There's a wealth of before and after pictures there available to you as well. But when we talk about TriPollar, really, you know, we kind of go with this term about seeing is believing. You know, when you get your hands on the device and actually see it work, and see it work on your patients, and see your patient get that wow reaction that they typically get from that first treatment, that's where this really all kind of comes together. Because you know, any of us has been in this business, this industry for any amount of time, you realize that, you know, clinical data is great, and you need that. I mean, we need sound clinical studies, and we need the science to be sound, but then it's got to actually operate in your clinic with the hands-on, and the device has to simply be functional. And one of the biggest strong points, I think, with TriPollar is, with all the benefits you get of it being painless, easy to use, etc., it simply works, and it works very, very well. So I would encourage you, again, to reach out to us, let us come in, bring this to your clinic, schedule that demo with you, and hope we have an opportunity to work with a few of you. And again, Dr. Shapiro, just wanted to thank you for your time this evening.
Thank you very much.